Okay, hello. Um, Today's seminar is on migraine. We're doing 2 hours and then a question answer session, and we're going to take a break, frequent breaks, so we don't get any migraines. I personally know that most of you guys probably have a headache because I have a little bit of a headache today, and I think it's that barometric pressure change. Um, so let's start off with defining what we're talking about. We're not discussing tension headaches. We're not discussing sinus headaches. We're discussing migraines. Now, sinus problems can bring on a migraine. Tension and stress can bring on a migraine, and you can have mixed headaches. But we're really going to focus on migraine. So what is a migraine? A migraine is a severe, painful headache, often preceded by an aura, something that warns you that it's coming. Warning signs occur, and then usually a headache occurs. You can have migraine accompaniments, which are flashes of light, blind spots, tingling in the arms and legs, nausea, vomiting, sensitivity to light and sound, with the headache or without the headache. The majority of people have the headache. Excruciating pain, one side or both sides, often behind the eyes, sometimes shooting and throbbing, sometimes in the occipital nerve area, which is the back part of the head. Excuse me. Migraines have all kinds of things that occur that keep them running and going. Dilation of the arteries, release of chemicals that cause inflammation and pain. The trigeminal nerve is involved, causing inflammation. We call it neurogenic inflammation, and there's a spread. A migraine headache causes sympathetic nervous system, which is the nervous system that's in charge of fight or flight, to respond and you have feelings of nausea, diarrhea, vomiting, delay in emptying the stomach, food absorption decreased, medication absorption decreased blood circulation to the hands and feet, getting cold hands and feet, and increased sensitivity to everything. Excuse me. More than 30 million Americans suffer from migraine headaches. Females are more likely to get a migraine headache than males. And these are severe headaches, a big problem. Now we're going to talk about migraines in a lot of different ways. We're going to go after a lot of different models of how to look at them and how to care for them and what they are. We're going to go over discussions about the genetics. We're going to go over discussions about brain lesions. We're going to discuss the science. We're going to discuss the symptoms. We're going to discuss the different ways the eyes are affected, the different ways visual perception can be different, the different ways it can be diagnosed, the kind of workup you need to get, the differential diagnosis, or all the different things it could be that need to be ruled out. We're going to go over all the different therapies, from the maintenance prevention drugs like the beta blockers and anti-seizure drugs and antidepressants, to Botox, to herbs and vitamins, butterbur, cannabis, coenzyme Q, feverview, magnesium citrate, riboflavin, B12, melatonin. We're going to discuss the surgeries, the spinal cord stimulators, the hyperbaric oxygen therapies, the vision corrections, the exercise, sleep, sexual activity, visualization, self-hypnosis, cognitive behavioral therapy, chiropractic care, acupuncture, special diets, all those things. Okay? And so there's a lot we're going over. But first we're going to start with just an idea. An idea that a migraine occurs when you're kind of at the top of the stairs. Okay? Each step up those stairs is like a trigger factor. Some of the trigger factors, they're 3 steps. When your young son comes home and he's crashed the car. Okay? When there's a great stressor in your life. That may be 3 steps up on the ladder. But when you get to the top of the ladder, that's when you get the threshold of migraine. You break over the threshold, you get the headache. So, what kind of things can cause you to break that threshold and get that headache? What triggers that event? Is it a smell? Is it chocolate? Is it coffee? Is it not enough caffeine? Is it a change in your daily routine? Is it not enough sleep? What are the triggers that lead you up those stairs to that migraine? That's something we're very important going to talk about, and I want you to think about what takes you up, what triggers your headache. The other thing that's important for you all to understand is the prevention medicines or the maintenance medicines. They make that ladder taller. It takes more triggers to cause the same headache, and takes more triggers to cause a more severe headache. And when you do have the headache, those maintenance medicines or prevention medicines or prevention remedies, as it may be, if a fever or something like that, they make the headache not as severe, so not as disabling. So you don't lose that day of work. You can go to those meetings. You can do what you want to do. All right. So keep that concept in mind, because that's how we're going to approach a lot of these things, with the idea that the migraine is the top of the stairs, and you got to work your way up it with triggers, and we can raise those stairs and we can erase those triggers. All right, well, let's get started.